it'd be like your check engine light's on and all the doctors want to do is just like put tape over the check engine light.
Yeah.
People are sick and tired of going from doctor to doctor thinking they just have a thyroid problem when in reality they have a much bigger, more complicated immune issue that's never being addressed.
I started taking that one supplement, and about 2 weeks later, I went from a 6 out of 10 energy, tired all day, to 10 out of 10.
The sicker a population gets, the more broad that lab gets. If you don't know how to read labs from a functional medicine standpoint, you're going to fail that patient.
That's right.
Your doctor is a clinical dinosaur if they say that. Find a different doctor, no questions asked.
If you've been to other doctors and you're dealing with something like hypothyroidism, autoimmune disease, digestive issues, or any chronic health issue, maybe you've gone in there and you've had blood work done and your lab results came back and they said, hey, listen, everything looks good, but you still don't feel good. Well, today I've brought back a guest we've had before. His name is Dr. Josh Redd, and we had one of our most popular episodes ever talking about the root causes of hypothyroidism and autoimmune disease, and even getting into things like stem cells and peptides. And on today's episode, we are going to dive deep in talking about how to treat different common conditions. We're going to go through Hashimoto's thyroiditis and hypothyroidism. We're going to go through SIBO. We're going to go through leaky gut. We're going to talk about autoimmune disease. We're going to talk about chronic infections like mold and parasites. We're going to get into PCOS and infertility, low testosterone, and so much more in today's show. And what we're going to do is we're going to go through how if we had patients come into our clinics, how we find the root cause and the treatment protocols we do in order to help somebody heal and reverse the condition. So Dr. Josh, thanks so much for coming on again.
Thanks for having me. It was great.
Well, cool. Well, I'm excited to dive in because this is going to be a type of episode that we've never done before, but really go through the root causes and how we discover the root cause, how we treat the root cause. And so I want to go through some different cases with you and love to hear your best recommendations.
Yeah, I'm excited. It's interesting too, because I always say with patients, you can go from A to B in 15 different ways. And one way that you might treat a patient might be a little bit different than how I treat a patient.
Yeah.
But the biggest goal is we want to get to the underlying mechanisms and not just treat symptoms. And if we can find and identify those underlying mechanisms, the patient ends up improving so much more. But how we do that could be a little bit different from one practitioner to the next. So this will be great.
Yeah. All right. So here's first question. A 42-year-old woman comes into your office. She has Hashimoto's thyroiditis, elevated TPO antibodies, fatigue, brain fog, constipation, and she's had some weight gain. Her TSH levels are normal. Her T4 is normal. What do you need to test for in terms of other blood work, and where do you start?
This is a great one to start with. When you have Hashimoto's, you have your immune system attacking your thyroid, right?
Yep.
Your thyroid is just a symptom of a much bigger problem. Our whole goal is to focus on why is the immune system destroying the thyroid at a rapid pace. So many patients will have a normal TSH, just like this one patient. They'll have symptoms like crazy. They'll go from doctor to doctor and they're given thyroid hormones, but nothing's being done to the autoimmune patient, and to the autoimmune process. And so this patient goes from doctor to doctor. They feel like they're crazy, they're lazy, they've lost all hope. Nothing's being done to help manage their symptoms and their problems, but this is because the mechanism isn't being addressed. So in this case, it's the immune system, not the thyroid. Which it'd be like your check engine light's on and all the doctors want to do is just like put tape over the check engine light.
Yeah.
We want to actually identify what the heck is going on with the car. Like, let's look under the hood. Let's see all the different imbalances that are causing and driving the Hashimoto's to flare up. And so that's the goal. Now, most low thyroid patients, it's more of a systemic issue. It messes with the adrenal glands, blood sugar issues, intestinal tract, liver function, brain. Brain inflammation is a very real thing when it comes to a Hashimoto's patient. This patient is a walking inflamed nightmare and nobody knows what in the world to do to calm it down, right? So as a practitioner, our biggest goal is to do like a very extensive systemic blood test. Let's look to see how your blood sugar levels are. Let's look to see how your hormones are. Too high of estrogen and too low of estrogen will flare up the Hashimoto's. If you have insulin surges, that will flare up the Hashimoto's. Cortisol defects in the adrenal glands, which are your stress glands, play a big role in flaring up and making Hashimoto's worse. And so if they have lower cortisol or higher cortisol, that will flare up the Hashimoto's. The intestinal tract, usually when we see a Hashimoto's patient, almost 99% of the time they have intestinal permeability, which means when they eat, their food protein should be digested properly. If they're not, then it absorbs into the bloodstream, and then their immune system reacts to those food proteins and then flares up the Hashimoto's as well. And so just looking to see and identifying what's causing leaky gut and what's causing poor digestion and absorption, that's a big thing for us too.
Yeah.
Another really common thing that we see with our Hashimoto's patients is they'll have what's called a methylation problem. So homocysteine, this is a really easy marker for anyone to check for. You can check in your labs and you'll check homocysteine. It's like an $8 test. If homocysteine is above 8, it's flaring up the Hashimoto's, no questions asked. And there's lots of easy things you can do to get the homocysteine to be below 8. And one of the simple things that you can do is just by taking methylated B vitamins to get homocysteine below that. Another really common thing that we'll do for a Hashimoto's patient is to look at vitamin D levels. Vitamin D levels, when they're optimal, they improve what's called the regulatory T cells, which actually calms down an autoimmune response. A lot of our Hashimoto's patients will have what's called vitamin D receptor polymorphism, which means even though they have optimal vitamin D, it doesn't bind onto the receptor properly, and then you'll have the Hashimoto's flare up. And so if we can really optimize vitamin D levels, I like them to be around 60 to 80. If we can get vitamin D levels to be optimal, that will significantly decrease the autoimmune response and all that as well.
That's so good.
There's a number of other things that you can do, like avoiding inflammatory foods right away. We'll do a food intolerance test with our Hashimoto's patients, and we'll kind of see exactly which foods is that patient eating that's causing the Hashimoto's to flare up. If they're having an immune reaction to food, they're going to have an immune reaction to their autoimmune response as well. Those two kind of go hand in hand. You can't eat a food and your immune system freak out without your immune system also freaking out and attacking the Hashimoto's.
Yeah, right.
A lot of times with our Hashimoto's patients too, we screen for other autoimmune conditions. Most of the time, they're not just suffering with one autoimmune condition. They have multiple autoimmune conditions creating problems. So we'll have our Hashimoto's patient that comes in, they end up having antibodies attacking neurological tissue, or antibodies attacking joint tissue, or intestinal tissue, or whatever that may be. And you typically don't see a patient just having one isolated autoimmune condition. And so that's really important. Now, from a hormone standpoint though, there's a lot of things that can happen. So when somebody has Hashimoto's, especially in females, we see this a lot. Estrogen tends to build up quite a bit because they have liver detoxification problems.
Right, yeah.
If there's even an ounce of liver type issues in their blood work, that's one of the first things we'll get functioning the fastest, to get their liver to clear toxins, estrogen, thing like that. And usually when we do that, the patient improves just within that first 30 days. One of the things that we'll see is you have what's called phases 1 and 2 of detoxification. If that process doesn't work, then that really flares up the Hashimoto's and causes a number of problems. And then from a hormone standpoint, check this out. I hope this isn't too much information, by the way. This is like rapid fire from my brain. But here's what we see. When somebody has an autoimmune disease, their body's in a lot of physiological stress. What this does to the adrenal glands is it makes the adrenal glands pump full steam ahead. And in order for the adrenal glands to function properly and to maintain optimal cortisol, it steals away progesterone. And so this patient with an autoimmune disease and Hashimoto's ends up having pretty much no progesterone whatsoever because it's being converted into cortisol, which is your life-saving hormone. So what that does is then it causes an estrogen-progesterone ratio issue. So we have estrogen dominance. Estrogen dominance is one of the biggest triggers for Hashimoto's. We'll have a lot of Hashimoto's patients that are on like birth control and other things that increase estrogen, and that causes problems. But then to make matters worse, guess what's your body can convert hormones into other hormones. It's pretty intuitive about that. But once your hormones get into estrogen has to clear through your liver and intestinal tract. If it can't clear properly, then that flares up the Hashimoto's even more. So now we have progesterone that's being stolen away. which causes tons of symptoms and problems. But then we have estrogen not able to clear properly, and that causes a ton of problems. And then what makes it worse is, let's say estrogen can clear the liver properly. Once it gets into the intestinal tract, then it's bound to a protein. And there's an imbalance that will actually break that estrogen off of the protein and pump it back into systemic circulation as more of a toxic and inflammatory estrogen, flaring up the Hashimoto's. And this imbalance is one of the most common imbalances that we see in America. Do you know what that imbalance is?
Well, I'm trying to think if you're talking about the blood marker, is it sex hormone binding globulin as part of that process?
So here's this. When estrogen clears the liver, it's bound to a protein to get excreted.
Yeah.
Blood sugar imbalances will activate beta-glucuronidase, which will break off that protein and pump estrogen back into the system.
Yeah.
Almost all of our patients that have Hashimoto's have blood sugar imbalances.
Yeah, yeah.
And just stabilizing glucose is one of the biggest things that you can improve.
Sure. Yeah. I mean, what I found is, if you can fix cortisol and insulin, I mean, it's like every other hormone just starts to come back into balance. Those are the pathways.
Yeah. You're so right. If we can manage stress, if we can stabilize glucose, that's one massive trigger down, and the patient tends to respond quite significantly. That's one of the first things that we'll do for sure. We'll look at liver dysfunction, we'll look at blood sugar imbalances, we'll look at cortisol defects. Those three, I kind of call the three-headed monster. If you can correct those three, patient's going to optimally improve and have a lot better quality of life.
Yeah, I mean, you said so many good things there. I want to just overview a few of these things. One is, when somebody has Hashimoto's thyroiditis, it typically isn't the same thing for everybody. I mean, oftentimes I think, when somebody goes to see a conventional doctor, they'll tend to think, well, I've got Hashimoto's, it's a thyroid problem, and that's where their head goes, it's the thyroid. You name several organs and hormones that are impacting the thyroid itself, or of course the immune system itself. You mentioned the gut, you mentioned the liver, you mentioned the adrenal glands. So this is sort of a multi-organ issue, and it's also a multi-hormone issue. You actually hardly mentioned a thyroid hormone, and you didn't. You mentioned
I don't care about
estrogen
the thyroid
and insulin and cortisol. Those are a much bigger deal when it comes to it. And so, what I was when I read off those lab markers, one of the lab markers that sometimes doctors don't even run, which is crazy to me with thyroid issues, is T3, which of course is a much more important hormone. And that conversion, to your point, happens in the liver, right? And so the liver might be the most important organ to a degree when it comes to thyroid health.
Yeah, you nailed it though. I literally don't give two rips about the thyroid because this patient doesn't have a thyroid problem. They have an autoimmune problem. Their immune system is going crazy. So if you can correct the immune system or enhance it or improve it, then that improves the actual destruction that occurs at the thyroid. Now, if a patient has a low thyroid, I want them to be on thyroid hormones. I'll prescribe thyroid hormones and get their TSH perfect for sure, because every cell in your body utilizes thyroid hormones for energy, right? However, if the patient has Hashimoto's, it's a much bigger, more complicated systemic problem. It's not just an isolated thyroid problem. And people are sick and tired of going from doctor to doctor thinking they just have a thyroid problem, when in reality, they have a much bigger, more complicated immune issue that's never being addressed. Sometimes patients suffer for 20 to 30 years and never have a doctor that thinks deeper from a clinical standpoint and tells them, hey, you have a lot more going on than just your thyroid, right?
Yeah. There's a study that came out recently, and you probably saw this. It was at Yale. It was also in the JAMA. And the study found this. It said 23 million Americans, mostly women, are taking levothyroxine, this common thyroid medication. According to the study, it said 21 million may not need it. Because when they looked at this study, they were getting people off of it, and people were saying, well, either my symptoms haven't changed, I feel just as good, or I feel better once they were getting off the medication. One of the things I found is, if we can start to support more cellular energy, this is why herbs like ashwagandha are so powerful, rhodiola rosea, getting things, changing the diet, getting B vitamins. To your point, that is so critical, especially, when I run blood work on thyroid hormone patients, we always run a MTHFR test too.
Which is so critical.
For methylation. And more than half, certainly, have that variation.
Yeah.
And it's not being addressed. And so, what I found is that most of the time, these thyroid medications, of course, this, they're not fixing the root of the issue, but oftentimes you can get their TSH to where it needs to be. Because part of what they found in the study was your TSH is changing based on the time of day. It actually changes based on the cycle where the woman's on in her cycle. And most doctors aren't even, bringing that into consideration.
Yeah. And here's the thing, when you have Hashimoto's, as it flares up, your immune system will destroy the thyroid more rapidly. And it will actually release thyroid hormones into the bloodstream the more rapidly it gets destroyed. And so Hashimoto's patients are in kind of an unfortunate circumstance to where they'll have hyperactive symptoms, where they're restless, they'll have insomnia, they'll have panic attacks, they'll have rapid heartbeat. And then when it calms down, you might have low thyroid. So their TSH is often like a roller coaster.
That's right.
And so getting to the mechanism and addressing the overall physiology, not just addressing the thyroid, is really important.
Well, and that's why, to your point, is the only way you truly fix everything is you fix lifestyle, you fix diet, you fix stress, you get the right nutrients in there.
Yeah.
And things start to balance.
So to summarize all this, just for fun, you have a patient that comes in with Hashimoto's and the doctor sees the TSH is normal and they don't do any form of treatment. If the TSH is high, they'll give them levothyroxine or some type of hormone, thyroid hormone, right?
Yep.
Now look at the difference between that versus what we would do. We'll do a way more extensive panel to identify every possible imbalance that's driving the autoimmune response to flare up. We'll address liver function, the intestinal tract, we'll stabilize blood sugar levels, we'll work on the adrenal glands, we'll improve brain inflammation, because brain inflammation is one of the biggest things for Hashimoto's. We'll look for and identify other autoimmune imbalances. We will work on digestion. We'll work on their diet. We'll work on their lifestyle. We'll examine their environment and see, is there anything they're exposed to that's flaring up the Hashimoto's? We might prescribe the patient low-dose naltrexone. We might do standard ozone IV treatments. We might do stem cell IVs. We might do a number of other things. Alternatively, there are certain peptides that are awesome for Hashimoto's patients. That's 20 different things compared to, nope, your TSH is normal.
Yeah,
that's crazy.
And again,
right?
And this is what you're doing in your clinic. This is what we're doing in our clinic, and it's really doing. Again, it's personalized. That's the thing I would say. I'd call it personalized cellular medicine. We're going and looking deeply into everything, including the blood work and other testing, and then dialing in the exact protocol to heal.
Have you ever felt like you're doing everything right? Eating clean, working out, taking all the right supplements, but your body just won't cooperate. Maybe you're tired, you're foggy, you're gaining weight, you can't sleep, and your doctor says your labs are normal. Here's the truth. Normal blood work does not mean your body is operating normally. It just means the levels in your blood work look okay, not that your cells are actually using them the way they should. It's like using the wrong map and wondering why you're lost, or putting gas in the tank, but the engine still won't turn over. Because if your cells are inflamed, stressed, or in survival mode, nothing you do will work the way it should. Your body's been whispering for years. Now maybe it's screaming, and you deserve someone who's actually listening. Go to mybloodwork.com and see what your blood work missed. What's really going on beneath the surface. Because you're not crazy, you're not lazy, you're just stuck in a system that was never built to find the problem. It was built to diagnose disease, not restore your health. At mybloodwork.com, we'll show you how to finally get your body and your life back.
Let's dive into the next one here, Case. So here's one, okay, and you've heard this before. A patient says, every doctor tells me my labs are normal, but I still feel exhausted, inflamed, achy. What biomarkers would you look at to uncover the hidden causes of inflammation?
So one, your doctor is a clinical dinosaur if they say that. Find a different doctor, no questions asked, right? On top of that, there's has to be reasons of why a patient feels bad. If a patient has symptoms and problems, the doctor just isn't testing the labs properly.
Yeah.
You have this lab range. This lab range will tell you what's normal and what's not normal. That lab range is typically a 6-month average of patients who've gotten their blood work done at that lab. And so there's different labs all throughout the country that will have different ranges. And the sicker a population gets, the more broad that lab gets. We do labs all over the world. We probably see 300 patients a day with my 10 offices combined. We had a lab in a rural area where like you would have full-blown diabetes and the lab range said you're normal. It was absolutely insane. So one, you can't trust the lab range. That's a sick range. Like when you get your labs tested and you go to the lab to get your lab work done, just look around at the people. You got a lady on the couch. She looks like she's dead. She opens her eyes and you're like, oh my gosh, that lady's not dead anymore. Like these aren't healthy ranges. These are sick ranges, right?
Yeah.
And so we have to look at those ranges and be able to look at, okay, what's optimal and what's sick.
Yeah.
Over the last probably 40 years, these lab ranges in our country, as America gets sicker and sicker, just get more broad and more broad and more broad. And so you'll have something that's just right, almost to the cusp of being high or low, but it looks like it's normal. And it's definitely not. That's driving symptoms, that's driving problems for that patient. But if you don't know how to read labs from a functional medicine standpoint, you're gonna fail that patient.
That's right.
So one, even if I didn't even test further, and I just knew how to read lab ranges from a functional standpoint, I guarantee that patient has reactive hypoglycemia, blood sugar issues. Yeah. We'll do a thorough workup exam. They probably have low blood pressure that's not getting blood and oxygen to the brain effectively, just from that number of things right. But then you look at inflammation. Then are they testing the C-reactive protein? Are they testing LDH, which is one of my favorite markers to run because there's a few things. If LDH is higher, above 180, that means that patient has an inflammatory response occurring. If it's around 140 or below, that means the patient has reactive hypoglycemia and the cells are literally starving for glucose. So just that one is a pretty good one.
Wow.
Homocysteine, which we talked about, if it's above 8, they have a methylation problem. That in of itself can cause lots of problems. Uric acid is an inflammatory marker, which is great. Another easy one is ferritin.
Oh yeah.
Ferritin is an acute phase reactant. When that's high, we have inflammation. If it's too low, below 75, then that patient could have iron issues, right? And iron is utilized to help transport oxygen throughout the body. So just optimizing that can really help, right? Other good ones are glucose serum. We love that marker. A morning cortisol or a salivatory cortisol test is great. Those are the markers that I would check, along with some other autoimmune antibodies with this patient that says all of her lab work is normal.
Yeah, I mean, I think you nailed it. There's one other test we started doing, which I really like. It was really an oxidative stress test. This allows us to know about, and of course, GGT is also good for this, looking at glutathione and acetylcysteine. But and we found that really effective with autoimmune patients. But I mean, you really hit on the big ones. I mean, looking at the antibodies, looking at CRP, looking at a lot of these other tests, and being able to tell, hey, what's the root cause of inflammation here? And the majority of the time, with the right lifestyle focus, the one, I'll throw out one outlier. On occasion, and by the way, this is not the majority of the time, but on occasion we see people that have some sort of infection, right?
Yeah.
Could be some sort of, microorganism that's kind of silently causing those issues in the body too. And I know you see that too.
Yep, which is huge. A lot of times when it comes to infection, these patients will have a chronic infection and you'll see white blood cells, not low, but they'll be really close to being borderline low. Mm-hmm. And you'll see the monocytes, or you'll see neutrophils chronically low as well. And that typically means the patient is suffering with some form of chronic infection. And until you can improve that infection, that patient could have symptoms of fatigue and low motivation and all that as well. It's great.
Yeah, one other marker that I've really enjoyed running and seeing, and it comes back is with a lot of patients, it's off is an omega-3 index.
Love that one.
I mean, it's it seems so basic. What's so funny? I started doing lectures about 20 years ago. And I would ask people in the audience, when I first started, I asked them a lot of questions to see what they may want to hear me lecture on. And I would ask people, how many of you have heard of what an omega-3 fat is? Like 10% of people. This is 20 years ago.
Wow.
Well, now every single person would say, oh, of course I know what an omega-3 fat is. But it's so crucial. You remember Dr. Sears, wrote his book and all. So, but yeah, these omega-3 fats are off are off on so many people. You know what's interesting is so most people are familiar with MTHFR, right? And this gene variant for methylation. There are so many other gene variants out there. Like I did a genetic panel on myself and my daughter, and I have a genetic variant where I don't convert omega-3s well. So, some people can convert ALA well from walnuts and grass-fed beef into EPA-DHA. Mine was the lowest on the index. So really the only way I'm getting EPA-DHA is fish and fish oil.
Yeah. That's brilliant. I love that. Another interesting one, which is crazy, but we see this pop up a lot more, is just red blood cells, hematocrit, and hemoglobin.
Yeah.
And why I say this is that oftentimes we'll see these three higher, and all it essentially means is the patient isn't drinking enough. Like we see a lot of patients come into our clinics and they're just severely dehydrated. We'll ask, like, what did you have for, like, how much have you drank today? They'll be like, I had a Diet Coke in the morning.
And a coffee.
Yeah. I had a Fresca at 4 p.m. and that's about it. And it's like, well, I have the best thing that's going to help you the most. It's called water. Drink more water. And just by being hydrated, all of a sudden the patient has more energy and things like that. But here's the cool thing is that instead of just guessing, you can run the labs, even basic labs. And if I know how to read them, or you have a practitioner that understands functional medicine and functional blood chemistry, you can see patterns and problems where the patient might have an imbalance, but it's not quite a severe pathology yet, but it's definitely driving symptoms, and that's the key.
Well, especially if you have multiple going on. And one of the great things about blood work, one other thing I just came to mind was ApoB, of course, for heart health when we're talking about inflammation. But there are, when you start to see these patterns, like, okay, I'm seeing a liver problem, or I'm seeing a problem with insulin over here. And this is why, to your point, I mean, again, blood work is so valuable, especially running multiple markers. Because the thing that you and I have seen too, when we're looking at these functional medicine ranges versus the conventional, a lot of times, they would have gone into their doctor, as this question I posed, and their doctor says, hey, everything's normal. But you and I might have, run our lab and there's maybe 9 markers that are borderline or off, but those together are all pointing to maybe one or the same thing. And then, I'll share a personal story here. I had, this spinal infection I had about 3.5 years ago, didn't walk for a year. And I had to get on antibiotics for a month. And I was able to cut down the time I was supposed to be on it for 3 months, but because I was in a hyperbaric chamber, like living in there every day, really cut down the time, everything I did. But afterwards, I was fatigued, Josh, for about a year and a half.
Yeah.
And I was just so tired. And I hadn't run blood work on myself. I mean, I did then. And of course, so many things were off that it was like, well, okay, I just need to do everything right. Yeah. And I was just really tired. And I went and finally I did a blood work panel, really looking more at cellular micronutrients. And I really just had one marker off, and it was vitamin B2, but it was like 0. I mean, it was absolutely at the very bottom.
Yeah.
And then my also mitochondrial score was very low because of this. I started taking that one supplement, and about 2 weeks later, I went from a 6 out of 10 energy, tired all day, to 10 out of 10.
That's awesome.
It was that one thing.
Yeah,
but that's the thing. If you do the right blood markers, and that was another point is that, so you brought up the ranges. One of the other issues today is most doctors not running the right markers to start. It's like, hey, we're going to run a CBC and CMP, and that's about it. Versus most people have never been to their doctor. They're not even testing for magnesium. Yeah, vitamin D, maybe iron, but they're not testing for most of these nutrients.
Yeah. I love that. One of the things that we see when somebody is tired all the time and they come back normal, one of the most common things that we see too is just simple blood pressure. So most people think their blood pressure is really good. Let's say they've been tired since they were 16 in high school, and they've been tired for 25 years up to this point, always tired. Oftentimes we'll look at that patient, we'll do labs, and their blood pressure is like less than 100 over 60.
Yeah.
And their blood perfusion's so poor. What this does, though, is they'll go to the doctor will be like, oh, your blood pressure is great. No, you have a blood pressure of a dead person, right? Of course you're going to be tired. Of course you're going to have energy issues. Of course you're going to be depressed. You're not going to be motivated because your brain is literally starving for glucose and oxygen and nutrients because your blood pressure is not pumping to the brain properly and distal tissues, right? And so oftentimes we'll just check their blood pressure really consistently. And if their blood pressure is really low, we'll do things to optimize blood perfusion and to increase their blood pressure. And almost overnight, you see their increase in energy just like that. They go from having fatigue for 20 years to within 1 week, you improve blood sugar levels and improve and optimize blood pressure. Overnight, they're way better.
That's so good. You know, a little bit of, a little bit of electrolytes will go a long way.
Here's the thing. So check this out. People wonder, well, how do electrolytes help you? Well, most of the time with blood pressure, you're going to have cortisol and adrenal issues. Mm-hmm. Guess what helps that? Electrolytes.
Yeah.
Electrolytes are vital to help with the adrenal glands. And all of a sudden now you have this more optimal, blood pressure. Licorice root is a really common one that we'll have.
Yeah.
Increase their sodium content. Have them eat more frequently. If these patients skip meals, they're going to have lots of problems. But these simple strategies, the patients that have had chronic health issues for a prolonged period of time, they're typically frail, typically skinny.
Yes, yeah.
They just don't look like they have as much vitality as they should.
Yep.
These are the patients that have been suffering for 20 years that you make these subtle changes, and within 1 week, they went from 0 good days a month to 30 good days a month.
Yeah, and probably the simplest fix too with that is just more sea salt.
Yeah.
I mean, it's just that really, I'm one of those people that would be more prone to that if I wasn't very conscious of it. And a lot of these people I found as well, they're craving salt. But they're not using it, and that's a problem. When we talk about rewiring the brain, we usually focus on things like mindset or neuroplasticity, but one piece that doesn't get talked about enough is inflammation. And even something like honey can matter here because not all honey is created equal. Certain types of honey can actually help support the gut environment where much of that inflammation starts. And your gut and brain are constantly communicating through what's called the gut-brain connection. So when your gut microbiome is out of balance, it can influence mood, focus, and overall cognitive function. And that's why I choose Manukora Manuka honey to balance this. Manuka honey contains antibacterial compounds that can act as prebiotics to help support beneficial gut bacteria. And if you want to try it, check out Manukora Manuka honey. It's become a staple of my daily routine. Head on over to manukora.com/axe to get 31% off plus $25 in free gifts with their starter kit for my exclusive listener discount. All right, I want to jump to the next one here. Okay, here's a case. A woman has bloating after every meal, constipation, brain fog, struggling with anxiety, and even some food sensitivities. Okay, she's already tried probiotics and certain elimination diets. What makes you suspect SIBO, and what would you do for that patient? Any other testing, any supplements? How do we start to reverse and improve and even discover if it's SIBO in the first place?
You just described 70% of Americans, right? Bloating and distension after meals. Yeah. Now we think it's okay. As we age, this gets worse, and we're like, oh, the bloating and distension is not normal? Like if you ask most of your patients if they have bloating and distension after meals, they'd probably say yes, right? SIBO is one of those things that can have kind of multifaceted as well. So just kind of explain this. When somebody has SIBO, they have built up bacteria in the small intestines. And when somebody eats, that bacteria kind of ferments the food that they're eating. Starches are likely to be fermented more, and then that causes more gas, more bloating, more issues. You really shouldn't have that much bacteria in the small intestines. But what happens is when this starts to occur, you're going to have a valve called an ileocecal valve. When the gas and distension occurs, it opens up that valve, and then all of a sudden you have what's called translocation of bacteria from the large intestines into the small intestines. And this is like a vicious cycle. Yeah. But this ends up causing brain inflammation. This ends up causing systemic inflammation. This causes a lot more problems than just bloating and distension, right?
Yeah.
A lot of the times too, so there's a few things, is we can do a lot of things to help kill the bacteria in the small intestines. That's pretty simple.
Yeah.
But we have to look at the mechanisms that drove this patient to get SIBO to begin with. One of the most common things that I see SIBO patients have is just brain inflammation and poor frontal cortex firing. And so let me explain this. The frontal cortex, when the frontal cortex fires to what's called the vagal nuclei, it increases digestive enzymes, which is huge for SIBO. If you have improved digestive enzymes, it's great. It increases gut motility. It increases blood flow to the gut. It improves HCl. HCl is one of those things that sterilizes the small intestine so that you can't have bacterial overgrowth. And so at first, when we're treating a patient, we'll improve HCl because it sterilizes the small intestines. We'll improve digestive enzymes. We'll have them do things to improve gut motility. When somebody has severe constipation, if your gut's not firing properly and you have slow gut motility, then your food can start to ferment and rot in the small intestines, and that can cause SIBO as well. But most of the time, patients will just, or doctors will just focus on the intestinal tract and they fail all day long because the mechanism wasn't that. The mechanism was the brain.
Yeah, I totally agree.
And so sometimes we'll have somebody with they'll get a concussion, they'll have trauma, they'll have brain inflammation, and then that ended up causing the SIBO. And so on top of that, we'll do a number of things that get the frontal cortex to fire. And some of my favorite things to help the brain fire to the enteric nervous system. So just to give you an idea, if I was going to dissect your brain and I had it out just like this, you would see this, let's say neurological tissue, you would see this huge webbing of net neurological tissue engulfing the whole intestinal tract. That's called the enteric nervous system. It's pretty much just one organ.
In fact, it's so much of it's called the second brain, right? Yeah.
It's if we were to dissect your brain and all the neurological tissue with it, you would see it's all connected. This enteric nervous system, this neurological tissue is all connected to the brain. And the frontal cortex, the brain fires to this enteric nervous system. And then we have all those really beneficial things to help improve digestion, absorption, gut motility, all that stuff. So what's fascinating is I have to do things from a clinician standpoint to get the brain to start firing to this enteric nervous system more effectively. One of the easiest ways that you can do is just gargling water aggressively for 2 to 3 minutes. That's such an easy thing. We had a patient with severe constipation. She would go weeks without going to the bathroom.
Wow.
And she started seeing us the second day in. She's like, "Hey, can I take a suppository?" It's like, "Hey, no, don't do that. Just gargle water aggressively every hour for the next 5 hours and let me know if that works." She texts me 3 hours later and she's like, "Dr. Red, I pooed." And I was like, "Ew, that's nasty." But she was so pumped, but all she did was she gargled water aggressively, and that caused the frontal cortex to fire to the vagal nuclei and to the enteric nervous system.
So interesting. This lines up exactly what I see in SIBO patients. And so I think what I found is the single biggest thing that typically causes, and there's other causes, is just living in that fight or flight state.
Yeah.
People are living in it all day long. Cortisol is being released. And so basically you're living in sympathetic with no parasympathetic. You mentioned the vagus nerve. And this is a lot of people and I see this with a lot of moms, it's they have something scheduled every moment of the day. Their brains never have 1 second to rest. And so this vagal response just isn't happening in the body. And the great thing about gargling and humming is that it is the fastest way, to your point, to just literally go right into that vagal state, right into parasympathetic.
That's so right. Good. So right. It's fascinating too to think that where I can just be overly stressed, so I can be this fight or flight, and that's going to inhibit my brain from firing to the vagal nuclei and to the enteric nervous system.
By the way, I found most of the time patients, when I tell them things like box breathing or gargling or these things, most of the time instead they want to supplement.
Totally.
But the reality is, this, to your point, this is what you're sharing is the most effective way to actually heal SIBO. And you want to do all the other things, but this, when you're thinking about root causes, the highest things upstream, this is at the top of breaking the cycle. It's so good.
It's exercise, right? You have to now go. So here you have this sympathetic dominance. It's almost like me having a massive bicep and me having 0 triceps. That's pretty much what's happening to the patient's brain, right? And so we have to physically go in and you have to put in the work every single day to get this to activate and get this to fire and to strengthen this parasympathetic response in order for this to function properly. And so gargling, humming, there's a machine called an alpha stim, which you can clip to your ears.
Yeah, and I've got one, I think it's called Neuropod.
Oh yeah, the Neuropod.
And I've been using that, and it's.
I love the Neuropod for sure. That's a great one. But any machine that you can clip to your ear and it stimulates the vagal is going to be important.
Yeah.
One thing that people don't realize, and this is kind of a funny one for people, but there's a massive amount of research, is coffee enemas. Coffee enemas, the caffeine, you don't absorb it, but the caffeine will stimulate the nicotinic receptors and then fire it back up to the brain and get this pathway to function properly too. That one's actually really beneficial because it helps with liver detoxification, gets the brain to fire more effectively. We'll typically have our patients do it 1 to 2 times a week, and that's really effective too.
Yeah. All right. Next question here. So a man comes in.
Finally getting to the males.
Yeah, I know. Exactly. 39 years old. Okay. He's unmotivated. His libido's low. Just doesn't feel like he's able to put on muscle anymore. Just doesn't feel as strong as he used to be. And just low-grade depression, not really depressed, but kind of low-grade depression constantly. And just feels just a lack of sort of, vigor.
Yeah.
What do you think?
Here's this, and it's unfortunate for the females because their hormones are a little bit more complicated, so it takes time to get them to improve.
Men are it's so much easier.
Men,
yeah.
If a male patient is somewhat motivated, he will dominate rapidly, and it always drives the wife crazy.
Yeah.
But in this case, this patient clearly probably has testosterone issues, probably has blood sugar imbalances, and has inflammation.
And here'd be another thing with it. Actually, regular testosterone is just, it's somewhat low, but free testosterone is absolutely just tanked.
Yeah. So here's the thing. In males, they have a number of problems. Is blood sugar imbalances or insulin resistance will cause testosterone to turn into estrogen. And then that will cause further insulin resistance. And then that causes more testosterone to change into estrogen. And it's this vicious cycle. So now this male has more of a higher estrogen, lower testosterone pattern, which is really bad for males.
Yeah.
And then they're tired, moody, depressed, have these issues, right? That's problem one that we see quite often. So just stabilizing glucose in males can make a huge difference so that testosterone doesn't aromatize faster into estrogen. The other thing is that when you have insulin resistance, it will also cause problems with inflammation. Inflammation increases. When inflammation is high in males, it degenerates the Leydig cells of the testes, which are the very cells that produce testosterone. So just calming down inflammation will inhibit or diminish the Leydig cells from degenerating, which will allow those cells to produce more testosterone naturally. And then all of a sudden this male has a lot better pattern. A lot of times too, when you see these males with lower testosterone, they typically have like a sedative lifestyle.
Yeah.
They're sitting at a desk all day long. Their caffeine, which is their adrenal glands are shot because they're consuming a massive amount of caffeine. Their blood sugar levels are really unstable. They're not getting sunlight first thing in the morning. Their circadian rhythm's off. And just improving that towards say, hey, let's get out first thing in the morning when you wake up. Let's get sunlight. Let's exercise. Let's get your cortisol awakening response up. Let's start to stabilize glucose levels. Let's calm down inflammation. And all of a sudden that patient in 30 days feel better than they have in 5 years.
Yeah, if men did 3 things, eat a diet where, to your point, is good for blood sugar. Eat a lot more protein and fiber. If men then would go and lift some weights, and if men would then go and just not overwork and have a little bit more fun, boom.
Done. It's unfortunately, and now with men, now we have peptides. Like as you get older, there's lots of things that we can do for longevity, right? We always want to optimize testosterone. We want to improve certain things. Now with peptides and with other things, if you can do diet, lifestyle, find the underlying mechanisms for that male patient, in 60 days, that patient, if they're motivated, will look like a human specimen where they're just like complete transformation really quick.
Yeah. I'll say, I'm thinking about, I had somebody come up to me in the gym recently, a guy, and he had said, hey, listen, he said, we're trying to get pregnant. And he said, I lift weights. He was a college athlete, really great college athlete. And he said, I'm eating really good. He told me his diet. I'm like, man, that is really good. He's like, my testosterone's still low. But he was a type A achiever working 50, 60 hours a week, nonstop. And it's like, well, that's... Just like females, when we are constantly consumed with stress and we're constantly going in this fight or flight, in females, progesterone will be stolen away into
into cortisol, right?
Yep.
With males, when we're in this fight or flight response, our testosterone will be completely taxed. And so we have to get out of that fight or flight response in order to optimize testosterone.
Well, in a very similar way, there's this whole pathway that you're talking about, but typically it's called this, the cortisol steal, right? Where basically cortisol, it's like your body's making a decision. Do I make stress hormones or sex hormones, right? Sex hormones, estrogen, testosterone, progesterone. No, but cortisol is stealing all of these materials to make stress hormones rather than the sex hormones.
Which that's the number one cause of infertility right now, right? What you just described is literally, now we have infertility rates exploding. That's the number one cause of infertility right now. If they just fix that, pregnenolone steal is what we called it. Then all of a sudden, now we have optimal sex hormones, and now having babies, kids, and all that stuff becomes so much better. But it's shocking how many people miss it.
Yeah, I had another patient recently came in with that same pathway, and it was for fertility. And the other thing that was high, though, was a sex hormone binding globulin. And that was basically just, I looked at the diet, it was so mineral deficient, it was like no zinc, no boron, like those were coming low on labs. And it's, so sometimes there are other things, but to your point, it's the biggest thing. It's definitely the biggest thing. Okay, here is another one. A former athlete has shoulder pain, knee pain, and low back pain. Physical therapy helps some, but they are still limited. They eat pretty healthy. They still try and exercise consistently. When do you start considering peptides, PRP, exosomes, or stem cell injections? And which of those do you like the most? And what would you typically recommend for this person, or how would you evaluate them?
Yeah, we probably see the most professional athletes in the country when it comes to stem cell orthopedic injections in our clinic. We see a really high volume of pro athletes. It's fascinating too. We don't want to just right away inject stem cells. That's not really how I do it. The biggest goal for us is, are there underlying imbalances that's impeding this athlete or this ex-NFL player or whatever it may be from improving or optimally healing? A lot of times we can have microadhesions in our shoulder, in our joints, because as we age, stem cells don't migrate properly. And when we're younger, stem cells migrate and start to heal things really fast, right? As we age, stem cells, our own stem cells, don't migrate properly. So we end up having microadhesions, almost like where we have scabs that are constantly being ripped off, different like small little adhesions that are bleeding, causing problems and inflammation, and the patient just doesn't ever improve. So typically we'll look at underlying imbalances that might be causing that patient to not heal properly. When we look at those two and the patient's willing to improve those, that's when we'll jump into stem cells and peptides as well. Now, with the advancements that we have, stem cell orthopedic injections are absolutely incredible. Like I broke my back probably about 8 years ago. I was paralyzed for a few days, in bed for a few months. Even after a year or two, I couldn't even sit down for more than an hour. I couldn't golf more than 9 holes. And I was just going to go to Germany and get a disc replacement. And I was already in the field of regenerative medicine and stem cells. And so I was like, you know what, I might as well give this a shot and see, since I'm going into that anyways. And I remember I got my stem cell injections. They injected my disc, they injected my facets, they injected my tailbone, they did epidurals. And it was the guy that I was doing my residency with. And I remember I drove from Chicago to Utah after 60 days after I got the stem cell injections, and I had zero pain.
Wow.
It was the first time that I was able to like sit for more than 1 hour and notice like, this made a huge difference.
I have a similar story in terms of, I had injured my back about 10 years ago, weight training. And basically I had pain for years and years and years. First time I really saw a big difference with stem cell. One thing I found with stem cell though, that's really important, and you kind of alluded to this earlier, is you need to do stem cell plus other things. Stem cell is incredible, but 2 other things to think about. One is getting on the right diet and supplements to support and keep inflammation levels low. The other thing is retraining the correct, posture and the correct function when you're exercising, because I had a lot of sort of dominant patterns. Like growing up, I was a cyclist and a soccer player. So everything was about my, a lot of quads. And so, and I was never taught properly how to squat. I'll give you an example of this. I had my weight trainer, my strength coach in high school taught people, don't let your knees go over your toes. So but all of that was more pressure on my back.
Yeah.
And so I found a guy, his name's Stephen Shin, incredible. And he does, this really advanced type of postural correction, PT, and I do Zoom videos with him, and I've seen him in person too. But having him do that with the stem cell together got me 100% of pain, 100%.
And that's always important. If we can send our patients somebody who can help with the muscular side of things and the physical therapy side of things, it makes our stem cells so much better.
The problem is also most physical therapists they're not trained in the right type of movements. You really have to find that top, 2 to 5% of
the muscle guys,
who understands that.
Yeah. So when I was at Johns Hopkins, my professor's lab, they could sever a mouse's spine and make it quadriplegic and then inject stem cells and it could fully walk again.
Yeah.
And so we're in that lab and I was like, holy crap, this is going to change all of medicine. And so I went back to naturopathic medical school, then into residency, and now we're doing the stem cells. But here's the cool thing with stem cell injections. We're clearly not there yet, but the advancements are getting better and better and better every single year. So the stem cells that I would use, like the umbilical cord stem cells that I would use 2 years ago, are the ones I'm using now are significantly better than the ones I'm using 2 years ago.
Yeah.
And 5 years ago, we would do like bone marrow and fat from, get stem cells from the patient's own bone marrow and fat. But yeah, it's stem cells every year. It's getting better and better. It's going to change all of healthcare soon.
It is. I agree. People think peptides are big, and we'll hit on that next, and they are. But I think stem cells are the other one up there with them, if not bigger, in terms of creating miraculous results in people. Which brings me to the next question. All right. Who is the ideal candidate for peptides? What symptoms or conditions make you think this person needs peptides at the forefront? And so I'd love to hear your thoughts on that.
So here's the thing when it comes to peptides, and this is where we've seen problems within our clinic, is sometimes you have peptides in the gray or black market that can actually cause more problems than good. And we've seen that within our clinics. Our patient population is extremely sensitive to their environment, to the food they eat, to what they put in their body. And so if they're getting it from the gray or black market, that's like a huge red flag, and that could be really problematic because you don't even know what's in there. Is it completely, watered down? Is there other things in there? Do they have a C of A, certificate of analysis to see exactly what's in there? The peptides that we use are all pharmaceutically, manufactured, and we have a certificate of analysis, so we see exactly what is in that peptide, and that's really important for us, right? Now, there's a number of ways. I love peptides done the right way. If I'm just doing a shotgun approach with peptides, I think we fail. Yeah. Just like supplements, just like medications, just like whatever, right? I love peptides similar to how I do functional medicine. I do the exact same thing with peptides. I'll do extensive lab testing. I'll identify what's going on with that patient. And if there's a peptide that could help get that patient from A to B faster, I'll use that peptide for a short period of time. Most peptides aren't to be used for long-term use.
That's right.
In fact, they can even be more problematic if you use them for long-term use, right? So a lot of times I'll use peptides for 1 to 2 months to help make a physiological change within the labs, and then we're done. We're rocking and rolling to something else,
That's
right?
Yeah, so good. Yeah. All right. And I know you have these people if you're taking care of a lot of professional athletes and things in Utah. Okay. A wealthy patient comes to you with unlimited resources, okay? They want your maximum longevity and performance protocol. What are the most important tests? Name 3 to 5 of those. The most important peptides, the most important supplements, any regenerative therapies that are going to be the best for longevity, unlimited resources.
You're putting me on the spot there. So I did a residency, his name's Harry Adelson, where we just did full body stem cell treatments.
It's the biggest thing.
On celebrities and pro athletes. We literally injected stem cells in every single joint in your body, your whole spine, epidurals, shoulders, knees, toes, scalp, face. It was about a 2-hour procedure. But with unlimited resources, we saw massive improvements, just that.
Yeah.
That's a really expensive procedure though. On top of that, when it comes to peptides or supplements or what tests to do, obviously, when somebody's looking for longevity, we'll look at blood sugar imbalances, we'll look at inflammation, we'll look at heart disease, cardiovascular health, intestinal stuff, right? So we'll do a DNA stool test, we'll do extensive blood work, we'll do a cortisol salivatory test, and we'll literally pinpoint every possible imbalance that we can correct there. And so we'll put them into a full functional medicine treatment plan where we'll literally just find every possible imbalance that we can and then work to correct it there. Then from, you have your options with stem cell treatments. Hormones, as somebody ages, we now know, beforehand, we used to think hormones were really bad for you, right? Now we know if you do hormones the right way, where you're not just guessing, you're doing the right tests, and then you're implementing hormone therapy, and then you're retesting, you can optimize hormones and you can really improve someone's quality of life and their longevity if you do hormones the right way, utilizing bioidentical hormones. So as you age, I'm a big fan in optimizing hormones, and research shows that minimizes cardiovascular disease, Alzheimer's, dementia, all sorts of things if it's done the right way. So I love optimizing hormones if that patient is older. And then from a peptide standpoint, there's lots of really good peptides, but I usually don't prescribe peptides just as a shotgun approach. I don't mind, doing microdosing GLP-1s for somebody that's looking for longevity. There's a lot of research out there that suggests that can be really helpful. But based off of what that patient needs will be based off of what I actually do. Now, from a supplement standpoint, let's get there. As we age, our glutathione demands increase. And so I love glutathione for patients as they age. I love things that will help decrease inflammation for patients. Things like, bioavailable turmeric, resveratrol, boswellia, those types of things. Omega-3s, which you touched on, are huge. Magnesium is one of those things that it does 600 different processes within our biochemical processes within our body. If you are deficient in magnesium, we can have lots of problems. So I love magnesium. We talked about methylation and MTHFR gene mutations. Most of the population as we age have methylation issues. In fact, there's research that shows if we have high homocysteine, it's almost paralleled with our risk of Alzheimer's. The higher homocysteine, the higher Alzheimer's and dementia will be for that patient. And so from a neurological standpoint, just improving methylation as that patient gets older is huge. So taking the right methylated B vitamins can be such a game changer, and that could be the most important thing that patient takes every single day for the rest of their life, on top of obviously eating healthy and avoiding inflammatory foods.
Okay, one more question. Somebody comes in with a limited budget, okay? What are the most important blood work markers to look at if they have a limited budget? Typically the top 3 supplements and the things that they can do on a budget that will make the biggest difference in their health when it comes to longevity.
We touched on them earlier. Stabilizing glucose, right? I'm going to look at glucose serum. I'm going to look at cortisol and stress hormones. And I'm going to look at liver markers. Those 3, if they're on a limited budget, I'll do in a heartbeat. And ironically, a blood test for this individual might cost $40 if they're on a limited budget. Some people think functional medicine is incredibly expensive. It's really...
It should save you money in the long term, absolutely.
But we could do a blood panel for $40 and know that you have blood sugar imbalances, wear a continuous glucose monitor, and let's stabilize your glucose so that your blood sugar levels are in between 80 to 130 regardless of what you eat. Just that one change puts so much stress off the adrenal glands and decreases inflammation. So if somebody was on a limited budget, I'd say, hey, let's dial in your blood sugar levels and let's eat in a manner where your blood sugar levels are stable. Just that one thing. And then we would do things to help with their stress response. When they wake up in the morning, let's get sunlight. Let's get that cortisol awakening response high. Let's do things as we wind down for bed to keep that cortisol levels low so that you have a good restful night's sleep. And then from a supplement standpoint, again, kind of similar, but if they can't afford much, glutathione could be really beneficial, methylated B vitamins, magnesium. I'll tell you my top 5 supplements. You want to know my top 5?
Let's hear 'em.
Vitamin D with K2, but we have to make sure that there's MK4 and MK7. So two different forms of K2, because those two, one's long acting, one's short acting. But what that does is it pulls calcium from your arteries, follicles, lungs, and puts them into the bones. So you have to make sure that you're doing vitamin D with K2. I add magnesium is a second supplement that I'll have my patients take. If there's 5 supplements that I have to take, magnesium is definitely one of them.
Yep.
Methylated B complex, because so many different people have methylated issues.
Yeah.
That's in my top 5 as well. Omega-3s are huge.
Yep.
And we like omega-3s from like wild caught fish. What I love is omega-3s with astaxanthin.
Yeah.
Because it helps so that the omega-3s don't oxidize and go into problems there. And then my last one is micronized and purified creatine. Ironically, for male and females, the research now is staggering, where it helps with your brain, it helps with anti-aging, it helps in so many different ways, far beyond just that. And if with creatine, you just have to make sure that it's tested for impurities. That's huge. There's a lot of creatine out there that's absolute garbage because it has a ton of different things in there that will cause endocrine disruptors. It can increase cancer. It has a lot of impurities in there that can cause problems. So you just want to make sure that you use a creatine that is tested for impurities and contaminants.
Yeah.
But I use a micronized creatine. Micronized will help it absorb better. It just makes it more like powdery. It's almost like powdered sugar.
Yeah. Yeah. And some of these too, I know there's crealkaline now. There's some that are, some people have some digestive distress. Not a lot of people, but there are some people with creatine. And so I think these forms are more absorbable, which is great.
Absolutely. So those are my top 5 for anyone. Omega-3s, vitamin D with K2, magnesium, methylated B vitamins, and creatine.
That's a great
What's
list.
your top 5?
That's a great.
If you only had to take 5 supplements, what's your top 5?
Man, it's going to be hard. So yeah, I mean, statistically, vitamin D and magnesium are going to be up there. I really love taking magnesium glycinate, but let me go back to this. Knowing my own blood work, I probably don't need vitamin D just because my D level's high. I probably take magnesium glycinate as my number 1. I would take a B vitamin. Actually, what's interesting is I did this whole genetic panel. I don't do well with methylcobalamin, so I wouldn't take a typical methylated B. I would probably take one that's B2.
So check this out. This is huge. Most people don't realize this. The most common thing is methylcobalamin. You just said
I do hydroxy.
But
and adeno. Yeah.
So you have the hydroxy and you have adenosine as well.
Yes.
There's 3 different forms of B12. If you have a methylation issue, the best supplement on the planet will have all three forms, not just one.
Yeah.
Which nobody realizes. So keep going. Sorry.
Yeah. So, but I would have that because I would do the methylated with the 3 different types. I can do some methylcobalamin, but higher doses, I get the wired but tired feeling.
Yeah.
So I would do that. I would do a high dose probiotic. I've just noticed for myself, it's good for, there are so many studies on nutrient absorption and GI regulation. And so that would be on my list. I would probably then do 2 more. It would probably, omega-3s, because I don't convert well, that's going to be high on my list. Creatine, it could make it. I'm trying to think if there's anything else. I might go for like a superfood formula that has turmeric and, pomegranate extract and a bunch of superfoods.
I love that.
But creatine would probably rank 6 or 7 for me too. But those would be the ones. Those are the ones that now listen, I take a lot of stuff. I probably take, I probably take 13, 14 different supplements a day or so.
Awesome.
But those would be at the top.
Yeah.
All right, last question.
Rapid fire all day is great. I love it.
Well, this may not be, we'll rapid fire this one as much as you can. Okay. You're the patient. Okay. You have come down with, all of a sudden your energy has dropped. Your gut's been inflamed. You have autoimmune markers that kind of out of nowhere just all of a sudden started coming on. What are the top 5 tests you would do on yourself, and what would your own personal recovery protocol look like likely?
If I instantaneously came up with something like that, I would check for mold.
Yeah. Okay.
I would check for my environment. I would check more things outside of my body than I would inside my body to see what am I being exposed to, what changed in my environment that is now causing my immune system to freak out. Is there an infection? Is there a virus? Is there mold? are there other environmental things that are maybe causing me and my immune system to freak out and to cause these issues?
It's so good. It's so good.
Completely opposite of.
Yeah, I totally agree. If you have something come on like that, it was a virus, a parasite, mold. Typically, it's going to be a pathogen causing issues. And we see this with people, right? And sometimes these people, they feel bad, they feel a little, they get somewhat better, but they never fully heal. Of course, we see this with long COVID people, but there's a lot of people out there living with these infections. Yeah. What are some things in terms of just the process quickly when it comes to dealing with infections?
One of my favorite things is obviously removing the patient away from whatever could be making it worse. But one of my favorite treatments now when it comes to mold and infections is actually standard ozone IVs.
Oh, I was going to say ozone.
Yeah.
I mean, do you guys do EBU in your office or 10 pass?
We do, but I've actually seen that like we can do high dose ozone IVs or standard ozone, and I almost see this almost just as effective.
Yeah, so you're doing MAH or?
Yep.
Okay,
yep.
Yeah, so great.
We now just have TPE in our office. As well, which is kind of the plasma exchange, like you've seen in the social media where they're holding like the big bag of we now do that too, which is really cool. And you can test microplastics, all sorts of stuff before, and then you get it done, which is about a 3-hour procedure. And then afterwards, you almost have no microplastics. All the environmental toxins are decreased, and so now we have that too, which is super cool,
super powerful.
Yeah,
I love it. Well, Josh, thanks so much for coming on. Again, we've had Dr. Josh Redd here, and you're one of my favorite people to have on. I mean, I love
coming on yours as well. Thank you.
Yeah, I love your depth of knowledge, and I love the way that you have this really incredible root cause approach of doing this advanced testing, and then you have so many different therapies and tools to help people heal and recover. And so I absolutely love that. I want to encourage you to check out Dr. Josh Redd. He's got clinics all over Utah, 10 clinics. In addition, he has a great social media channel you can follow at Dr. Josh Redd. Redd is REDD. So you can find him on social media, but check out his practice, check out him on social media. He's got great content out there. He's got a great book out called The Inflammatory Reset. I want to encourage you to check out his book as well. And I want to say, hey, thanks so much for tuning in here to the Dr. Josh Axe Show. Remember, every week we're diving deep into how you can heal physically, mentally, spiritually, and take your health and your life to the next level. Also, do us a favor. Subscribe to the podcast. It's the number one thing you can do to support the show and allow me to bring on incredibly brilliant doctors like we had with Dr. Josh Redd on. Also, you're not going to miss a thing. Sometimes because we cover controversial topics here, it doesn't always pop up on your feed. So make sure you're subscribed. Also, think about who's one person who could benefit from learning about some of what Dr. Josh and I talked about today. Share this with them on social media or as a text message. I want to say thanks so much for listening. We can't wait to see you on the next episode.